Decompression works because it actually is going to relieve the pressure from the disc to the nerve. The nerve is always the key, but it relieves pressure from disc herniations, disc bulge, sciatica, which is the pain down into the leg, facet syndrome, which is where the joints in the spine are jammed together, even degeneration. Decompression is going to work because it reduces disc herniations, disc bulges. It actually enlarges the space of the disc, and that's been proven multiple times on MRI.
We're all familiar with airplane travel and the cabins that are pressurized. So picture an airplane and picture a pressurized cabin. Now picture what happens when a window is broken in the airplane. All the contents of the plane is going to fly right out the window. That's because outside the airplane is negative pressure. And what we do with decompression is we create negative pressure inside the disc. That negative pressure that we create inside the disc is what decompression does. Creates negative pressure inside the disc, reversing the high intra-disc pressure. But watch, as we create negative pressure, we literally draw back into the disc the contents that may have spilled out. Just like in an airplane, when the negative pressure outside pulls everything out, when we reproduce that effect and we create negative pressure in the disc, we can draw back into the disc the discal components that have been bulged or protruded. Now, that'll bring relief, but that's not all, because we want to bring a cure to this person, and here's how decompression helps us to do that. As we draw back in the components of the disc that have been bulged out, we're also drawing back in nutrients. We're drawing back in fluids, vital fluids, with mineral and water and supplements that are needed to heal the disc. All that gets drawn back in, giving the disc an opportunity to heal from within. And imagine now, increasing the height of the disc, removing the pressure, reversing the high intradisc pressure, but creating the negative pressure that draws all those components back in.
The pain was so excruciating, even just to try to get around. Trying to eat, trying to get out of bed. My wife had to dress me, put on my socks, and it just completely debilitated me. I couldn't even function, you know. The procedure is pretty simple. You get on a table and you lay back, and they'll adjust the straps to fit your height and everything, and they prop your knees up with the pads under your knees, and strap you in and pull the curtains, and you feel a sensation of the pulling of your lower back and your upper portion of your body being pulled apart, and it was kind of a relieving feeling there, and very pleasant. I didn't have any sensation of pain during the treatment. And, very well. I think the table is the answer to a severe back problem. I've been here 3 weeks. I just completely stopped when my back problem just completely went away, and just like it never happened. Now I'm back doing crunches and playing golf and doing normal things.
So to accomplish decompression, what happens is this. People walk into the office on a normal visit. We have a computer sign in. You put your name in and sign in and tell us how you're doing on any given day. We do a brief warm-up. We call it a wobble chair. It helps prepare your spine for everything that we're going to be doing. It's a stretching exercise. It actually does indeed exercise the disc itself. It's kind of a unique process in and of itself. From there, we do something called applied therapeutic motion. And what we've discovered is this. The challenge that so many people have with low back pains, and the reason that people have gone from doctor to doctor and tried different things that wasn't successful, is most doctors are actually focusing on one small aspect. Well, what we found is we need to look at not only the disc, but we need to look at the muscles, we need to look at the spinal alignment, and we need to look at the whole picture, possibly even the nutrition, you name it. So what the applied therapeutic motion does, it helps us exercise the muscles. I'll talk about that in just a few seconds. And after we do that, we put belts on your back. It actually kind of looks like a bungee jumping belt. That's the best explanation I have. We're not making you a bungee jumping, but that's what the belt looks like. And from there, we lower the table. The table will raise. Most of the people could actually climb on the table, but we do have some people that have started in such severe pain that they literally couldn't, getting from standing to laying down is a problem. So the table comes up. It's called a high-low feature. And it'll lay down flat as this table is, just like that. It actually feels like you're going subtly upside down, but you're not, I promise you. I had to put a level on it, because after I laid on it the first time, it felt like it was just a little upside down, but it's not. Then, we tighten the belts, because we want them to be fairly tight, because we don't want you sliding on the table. And we'll connect the decompression harness, or the decompression belt, to the harnesses. And the machine does what it needs to do. It takes about 25 minutes on the table. It's a pretty comfortable process. There's no pain associated with it at all. And the computer will ramp the pull up and down, and we're only going to use somewhere between 30 to 40% of your body's weight. So we're not using a tremendous amount of pull. The challenge with traction in the past has always been the only way for traction to work was a stronger and stronger pull, but the stronger something pulls, the more the muscles spasm, and then we end up with a bigger problem than we started with. So what ends up going on is after we've gone through this process, the table will raise back up, and then we're going to use ice for 10 minutes. After we do the ice, we're going to check your body every single visit, and we'll do a cold laser to help the healing process. The whole process in the office, each office visit is going to be about an hour, give or take just a couple of moments, depending on how fast someone's moving. But we work real hard to have almost no wait. You're actually doing something the whole hour. It's not that you're waiting a long time. My girlfriend had to go to a doctor's office this week, and we waited 2 hours to see the doctor. I just could not stand that. I had a conversation with their office staff. I was like, I run a medical office. I know that this doesn't have to happen this way. We also have the ability to target specific discs because we can change the angle on the table. You'll see Kim playing with the computer and making all of the different settings correct because each person is unique. No two people have the exact same problem, so we have to make some changes and some settings to the table. The disc will become renourished, the disc space is heightened, and the neurocompression is relieved. We've had success with all ages. In my office alone, we've had people into as early as their 20s and up to the late 80s. And almost everybody gets good success. And the reason for that is we're only going to accept patients that we know that we're going to get success for. That, and I'm pretty tenacious. Once in a while, we do have a challenge. I will tell you, not everybody makes it look easy. A few people do, but most of the time, or sometimes, we have a challenge, but we will do whatever modifications, and we'll find a way to make this work. Because as we address the muscle, the bone, the joint, the skin, the disc itself, the nutrition, the hydration, maybe detoxification, you name it, by addressing multiple facets, it's one of the reasons that we can get the success where some people or some clinics simply may not. Patients come to us for relief of pain, and that's usually what brings people into the office, is something hurts. That's usually what motivates people to get out of their house and come to us. But as I've mentioned a few times, because I really think it's my priority, is it's about getting your life back. It's about getting to be able to do the things that you want to do. For some people, it's cook dinner for the family. Other people, it's take care of their house. Somebody else, it may be able to go to work and be able to sit behind a desk without being in excruciating pain. And for the next person, it's being able to play with their grandkids or being able to pick up their own children because of what's going on with them. And what I recognize is that it's the disruption of your life that really causes you to do something. And my main focus is making sure that we get you back to your life. In addition to dealing with the disc, as I mentioned a few times, many times we're going to actually continue to work with people with something called core strengthening, because not only do we have to look at the disc, but we have to strengthen the muscles. Sometimes we have to fix the joints first, so sometimes there's a process that goes on. So as Ann talks with you this evening, she'll tell you she's just started the core strengthening aspect of it, because we're working on strengthening the muscles, because we don't want problems to be re-injured. We don't want to re-injure, because what happens is the muscles become weak first, and that's usually where disc problems develop after that. So we have to kind of untie it backwards, if you would.